And good morning. Welcome to Community Voice. I am your host, Josh Engel. Today is Friday. It's Friday, everybody. Friday, October 27th. Today we have a very special guest in the studio with us today. We have Tanner Health System. More particularly, we have the Tanner Hospice Care group today in the studio with us to chat a bit about the program, as well as their upcoming event, Dine Out, Do Good. I love that name, Dine Out, Do Good. We have Miss Debbie Brock, as well as Mrs. Nichole Fannin. And we're going to be talking about a lot, so we'll just get right into it. Of course, about the program itself, about some of the things that sets it apart and makes it special, and how lucky we are to have this program right here in our own community. So let's get these mics a little closer over to y'all. First and foremost, good morning.
Good morning.
Thank you both for coming on the show. Let's start with Debbie Brock. If you could tell us a bit about you. Tell us a bit about Debbie Brock.
All right. I'm a Carrollton girl. Been here since I was 5 years old. I went to Carrollton High School and back in the day, West Georgia College, which is now University of West Georgia. I have been with Tanner Health System now for 24 years. I do home health and hospice. I'm the director of those programs and just very involved in my community. I know years ago, as when I was younger, Carrollton did not have a hospice agency. So back in the early 90s, a group of volunteers formed what was Hospice of Carroll County. And then in 1999, it became part of Tanner Health System. So just very proud to be a part of that. My staff are local people here, nurses, the physician that drives the program, people you go to church with, people you see in the grocery store. So just very, very, very proud of our program and how it's evolved over the years and all the ability to serve the patients in our area.
It takes a very special kind of person to do this kind of work. I think all of us are somewhat familiar with the emotional toil that can take on not just the families and the patients, but the caregivers that are working with them every day.
That is absolutely true. I always say hospice nurses are born, they're not made, and it takes such a high level of commitment, dedication. It is just a special nursing and medical care. It's a transition of care at the end of life and the support that's available. And it's not always just about the patient. It's so about the family, the friends, everybody that's involved in that patient's care. And we rally as a team. It's not just the nurses, it's the physician, it's the home health aides, it's the social workers, the counselors, the chaplains. Everybody's engaged in there to provide that care and to be that support. And it's 24/7. There's always an RN on the night shift that's available when there's a problem to go out. And they're, like I said, they're right here in our community. Back many, many years ago, it could be 2 to 3 hours because someone had to travel out to this area from the metro to come into some of the rural areas.
Such peace of mind knowing that you have that. I don't know, we're going to be talking about that bit no more, but here in a bit. But I mean, it's such peace of mind for the families to know that we have that kind of care just one phone call away.
Absolutely.
Let's throw it over to Mrs. Nichole Fannin. Good morning, Nichole.
Good morning.
So tell us a bit about you, your title, and a bit about Nichole's history.
Yes. Well, I am honored to serve as the executive director of the Tanner Medical Foundation. We are the philanthropic arm of Tanner Health System, which is a nonprofit community health system. I joined Tanner just a little over a year ago. Carrollton is home and has been home for over 20 years. I came here to attend the University of West Georgia, where I have both of my degrees, so go Wolves. We're fellow
That's right.
Wolves in that regard. And I fell in love with the community. My husband and our 3 children are here. We spent some time working at several of the industries in Carroll County and have just really loved and been inspired by how much the community rallies around each other, opportunities to improve, and really focusing in on healthcare. It's been amazing to get to be part of the Tanner team and just see their incredible compassion and connection to the community and the patients they serve.
Sure, definitely. Well, could you speak briefly on the foundation, a bit about the mission of the foundation?
So the Tanner Medical Foundation was founded in 1988 to help serve the community at large. So as a nonprofit healthcare system, Tanner does not turn people away based on their ability to pay. And so through the foundation, we work with community partners and donors to help provide patient assistance, whether that be for medication, treatment, transportation to and from treatment. It also helps to provide the equipment that we use, whether it be in our oncology, in our Richards Cancer Center. It also helps provide surgical beds, equipment, NICU supplies, the full gamut of anything that you see within the healthcare system. Our donors help to contribute to that and make sure that our patients receive excellent care here at home.
So I did want to remind everyone we are live streaming on our WLBB Facebook page. So if you have any questions or comments for our guest, both from the Tanner Medical Foundation as well as the hospice program, feel free to hop on there, throw them in. I'd be more than proud to read those out to our guests. So Debbie Brock, Miss Brock, let's talk a bit about Tanner Hospice Care. You touched on it earlier a bit about the just the availability to medical professionals, but I believe that there's some other elements you could speak to as well.
Sure. When a patient elects to come on our hospice program, they can receive comfort measure care in the comfort of their home. Most of the care is provided there so that they don't have to go back and forth. If it's stressful, clinically, to go back and forth to the hospital, even to the physician, because the physician is still engaged and is driving that patient care, along with the medical director of the program, who is Dr. Taylor Gordon. And the nurses, all of the team works together with them to just manage that patient in the best manner. Now, if something happens and there are symptoms that occur that cannot be managed in the home, then we have our Tanner facilities. Higgins, Villa Rica, Carrollton, depending on where the patient lives. If we need to go into the hospital for a while to get some symptoms managed, get things under control, then we can do that. Another component of our program is respite care. So say the family just needs a break. Patient's doing pretty good, but we can also utilize our facilities to put the patient in for a 5-day period of time under the Medicare guidelines. And we can take care of them there. It's like they're home away from home. The family may need to go on a vacation. Maybe they're just tired and they just need some downtime. So that is also a very, very big component of that. But then there's our bereavement program that follows a patient's family for a year after the episode of care. There's support groups, grief support groups that are ongoing all the time at Tanner, and they're open to the entire community. They're not just for people that have had a patient that have been served by Tanner Hospice.
I did not know that. So if people in the community are struggling with the loss of a loved one, these services would be available to them as well.
Yes.
I don't think that most listeners are aware that this program is that all-encompassing, because you're essentially laying out, care from the very beginning. Once the symptoms start presenting themselves to where in this individual, the patient might need to be under hospice care. This is under close direction of a doctor, but this is something that continues throughout the entire duration of their care, including after their life.
Yes, to help with the bereavement process. There's so much support with, other members who have lost family, friends. They all come together. We have a group that are survivors from years ago that still get together once a month and have dinner. We've had people that have met, a widow and a widower that married 2 years later from that group.
It's like a Nora Ephron film.
Yeah, it is. It's just a very, very good support system that's available.
Fantastic. Well, the time is 8:39. We'll go ahead and take our first commercial break, but when we come back, we'll continue our conversation with the Tanner Hospice Care Program as we chat with Debbie Brock, the director of the hospice program, and Nichole Fannin, executive director of the Tanner Medical Foundation. Community Voice, brought to you by Oak Mountain Academy and Tanner Health System.
Oak Mountain Academy is an innovative school of academic excellence celebrating a 61-year legacy. I'm Patrick Uran, head of school, inviting you to join us for our annual Fall Festival, today at 3:30. Join us at the OMA Gym for food, fun, and fellowship. Costume, games, raffles, and competitions are just a few of our Fall Festival exciting activities. For more information, visit us at oakmountain.us. Discover your journey at OMA. Prepare, explore, and achieve.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
And we're back to Community Voice. Time is 8:40. I'm your guest, Josh Engel. We are chatting with the Tanner Hospice Care program here on the Community Voice program. We are live streaming also on our WLBB Facebook page. So if you have any questions or comments for our guests, come in here and type those in there. I'd be happy to read them out to our guests while we have them here. We have their ear. We can ask them some questions. Feel free to hop on and we'll talk about that. If you're just tuning in, we were just chatting about the overview of the hospice program, how all-encompassing it is. Regular in-home visits from your care team, 24-hour availability, 7 days a week, pain and symptom control. Not to mention the aftercare that comes along. You have follow-up with the families, periodic phone calls, visits, counseling, grief support groups, memorial services, pretty much anything you could imagine to make the process a little less painful, a little less difficult. Tanner has thought it out. So if we could, Ms. Brock, let's chat about the coverage. This is something, I know a lot of people get really stressed out when they hear these, about these programs. They seem almost too good to be true. It solves a lot of the problems, but how, in terms of coverage, how is this covered, by Medicare? You mentioned Medicare earlier.
Yes, Medicare covers 100% of the hospice fees. Most commercial insurances also have a hospice benefit, as well as Medicaid. We accept all of those payers. We serve our community. Like I said, we were founded here, grassroots group of people that got it started. Tanner's commitment to this community, I think everybody knows. If you need us, we're there. And when you go under that benefit, for example, with Medicare, we then take over the cost of all the medication that's related to that terminal illness. We provide the medical equipment that's needed in the home to best serve the patient. You may need a hospital bed, oxygen, all of the DME needs that people have to be supportive, if it's, a shower chair. And then the support services to come in with that. There's no limit on the number of visits. That's done. There's a nurse case manager that does the admission process. She discusses the case with the physician. The interdisciplinary team drives the patient care. They meet every week to talk about what's going on with each patient and make changes according to how things are going. There's medication changes that occur. There are things like I mentioned earlier. There may need to be a short hospital intervention, which is not real common, but maybe a change in medication regimen to continue to keep the patients comfortable. So all of that's done, just a very collaborative effort by all those team members. There's a home health aide to come in, get you in the shower, get a good bath. Everybody likes to have those personal care services. And that's just a very big part of being comfortable and feeling good about yourself. In home health, some people may be aware that you have to be homebound under Medicare to receive services in the home. That is not the case with hospice. You do not have to be homebound. We, as a matter of fact, encourage our patients to be active in their daily life, the community, take vacations, whatever they need to do or want to do and feel like doing. We just, recently had a patient that came into our area for a month to visit with family. So the hospice they were with reached out to us, and we did a temporary transfer so that we would be available to that individual if anything happened while they were here. Nurses were going out, checking on them. Everything went perfectly well, and they got to go back home. But we can do that as well. If we have, say, for example, one of our patients wants to go where, maybe an extended vacation, we can coordinate with a hospice in their area to make sure those services are not interrupted.
That's amazing. That's fantastic. So, do we know the length of time that Medicare would cover hospice?
Well, there's not an end date, so to speak. The criteria is that the patient continues to, if the disease takes its normal progression, then there is some decline over a period of time. Hospice is done in benefit periods. You admit for a period of 90 days and then 30 days, and there's a recertification visit that's done at the end of each of those by a nurse practitioner who goes in the home. She assesses the patient, determines, yes, do they still meet criteria under the guidelines of either Medicare or the insurance carrier, and then they'll be recertified and stay in service. Now, the happy days are you may get admitted to hospice and then improve. And if that happens, then we work with the patient to transition them into the discharge process to go back under, their previous method of getting their medical care, and, will come out for a while or sometimes indefinitely until maybe the disease reoccurs and we go back in.
So we've established that Medicare, of course, would cover hospice care at home. What about hospice in a nursing facility, in a sort of skilled nursing facility? Would Medicare cover that as well?
Sure. Yes, we have patients that are in assisted living centers, patients that are in nursing homes, are all eligible for hospice services because that's their home and that's where we provide care.
Excellent. So how would, in terms of paying without Medicare, let's say you didn't have Medicare, could you speak a bit about to the patient paying that without it?
Sure. Our services are available regardless of ability to pay. That's part of our mission to this community. We have excellent opportunities through our financial services division for patient assistance, applying for any kind of medical assistance through any of our facilities. Fortunately, the strength of our foundation lets us do that. But never want anybody to hesitate to reach out to our hospice if there's a need and they don't have a means to pay.
Excellent. Speaking of the foundation, we are about to pivot the conversation over to the executive director of the Tanner Medical Foundation, Nichole Fannin, as we chat a bit about the Dine Out Do Good event that's coming up very soon. But first, we're going to take our second commercial break. Time is 8:47. We'll take our second break, and then we'll come back and continue our conversation with Debbie Brock and Nichole Fannin as we continue to chat about the Tanner Hospice Care and the Dine Out Do Good event. Tanner Community Voice brought to you by Oak Mountain Academy and Tanner Health System.
Oak Mountain Academy is an innovative school of academic excellence celebrating a 61-year legacy. I'm Patrick Uran, head of school, inviting you to join us for our annual Fall Festival today at 3:30. Join us at the OMA Gym for food, fun, and fellowship. Costume, games, raffles, and competitions are just a few of our Fall Festival exciting activities. For more information, visit us at oakmountain.us. Discover your journey at OMA. Prepare, explore, and achieve.
Health is a journey. It's making better choices, even when it's not easy. It's taking care of yourself and the people you love. At Tanner Health System, we're there for you with every step, with primary care, heart care, cancer care, women's care, orthopedics, surgical services, and so much more. We're dedicated to helping you live and feel your best. So let's get on that journey to health. You've got places to be for many years to come. Find us at tanner.org.
And we're back to Community Voice. I'm your host, Josh Engel. Today is Friday, October 27th. If you're just joining us on the Community Voice program, we are live streaming on our WLBB Facebook page. So for the last 10 minutes or so, if you have any questions or comments for our guest, feel free to hop on, type those in, and I'll read them out to them. So we're going to pivot the conversation real quick. Let's take it over to the executive director of the Tanner Medical Foundation, Nichole Fannin. Hey, Nichole.
Hey.
So let's talk a bit about the Dine Out Do Good initiative that Tanner's undertaking.
Yes, we are very excited to launch our very first Dine Out Do Good initiative that takes place beginning on October 31st and runs through November the 11th. It is a modern spin on a tradition that has been associated with hospice for a long time. That was the Hospice Holiday Food Sale. and that sort of sunsetted or went away prior to the pandemic. So we're excited to revive that tradition in a new way and do it in a way where we can engage our local community and business partners to really rally around Tanner Hospice Care, not only to support patients within our community, but also to help educate folks on what hospice can offer to them and their families if they need those services.
So this is a bigger and better revamp of a tradition, something that went on for some time.
Yes, we think so.
Cool.
We are very excited.
So let's talk about what folks can expect. Those who participate. Let's talk about the actual program itself and what folks can expect with it.
Yeah, of course. So we have 4 community partners and vendors restaurants throughout the West Georgia region who have given us dates and agreed to contribute up to 15% of their profits and proceeds from those days. Of those vendors, we have Nothing But Cakes. They are going to be at Tanner Medical Center Villa Rica on October 31st. They set up around 10 a.m. So folks in our community can go visit Nothing But Cakes, get all of the snacks you need for your Halloween party that evening, for the upcoming weekend. They're going to be a great partner for us. Then on November the 6th, we hope that everybody will go out and visit American Pie Pizzeria here in Carrollton for dinner from 5 to 9 and help to support Tanner Hospice Care. We're grateful to American Pie for all that they do to serve our community. They're phenomenal.
They're amazing. I love them so much. If you think the pizza's good, talk to the
Yes.
people who own it. They're so cool. They're such a longtime friends of the station, but they're so supportive of nonprofits and organizations. Any good cause, they'll get behind it.
They're phenomenal. And then again, on Thursday, November the 9th, Nothing But Cakes will be at Higgins General in Bremen. So if you are in the Bremen area, we'd love to see you stop by, purchase your sweet treats and your goodies, getting ready for the holidays and hosting all of the family. And then on the evening of Thursday, November 9th, you can visit Chick-fil-A off of Bankhead Highway. We're grateful to David Daniel and his team for agreeing to be part of our Dine Out, Do Good event. So we hope that people will join us for dinner there. And then on Friday, November the 10th and Saturday, November the 11th, Tropical Joe's in Bremen is going to be contributing 15% of their proceeds from those 2 days to help support Tanner Hospice Care. So we are grateful to all of these partners for stepping up and helping us to do good in our community.
That's great. So how did this come together though with the partners? Did you guys just sort of start reaching out? How did this come together?
Yeah, so when I joined Tanner a little over a year ago, one of the areas that we revisited was how do people connect and engage with the Tanner Medical Foundation? What are the areas that are of greatest opportunity and interest to our community? And so sitting down and thinking through the history of the food cell, we got to thinking, what could we do that could revive that in a way that helps us to engage more people and to really educate more in our community about the services of Tanner Hospice Care? And so from that was born the idea of Dine Out, Do Good. We looked through a lot of different cities across the U.S. might have similar programs, and we thought this is a great way to not only help to support Tanner Hospice, but to also engage our community and celebrate those partners who are just so critical to our success at Tanner Health System. And so we get to do that with 4 of the partners in this year's program.
And plus, it's always cool to revive a tradition. If leading up to the pandemic, there was the food sales. Did those used to happen at the hospital, I imagine?
They actually were at the First Baptist Church here in Carrollton.
Oh.
We would have it in the social hall. Ladies in the community, men in the community would all rally through different churches. We would go out and pick up food. They would cook. We would have it the Saturday before Thanksgiving, and we would have people lined up down the street when we opened the door on Saturday morning to come in and get their treats, their food, for their Thanksgiving feast. So that was just something that really had grown and grown over the years, and it was our largest fundraiser each year for that program. And then, like I said, when the pandemic happened, we just couldn't do it anymore. So thanks to the foundation, they came up with this alternative plan that we're so excited about.
But see, that's what I'm talking about. As you were laying out what the history of that program was like, what it used to be like. What a great opportunity to network and get to be around people in the community, and everyone can band together to do something good. This is such a streamlined version. This is, the restaurants, these partners are coming to these facilities. And they're scattered throughout the county here. So people can go and support can go support these initiatives closer to home. And it's widespread, it's bigger, and I mean a big portion of the proceeds go to the program. I mean that's fantastic. Now, is this something that we imagine we're gonna keep doing?
We would love to. This is our first year. We're hopeful that it'll be successful and the community will come out and help support us. The timing is purposeful, as November is Hospice Awareness Month in the community, and the need is great. One of the things that I don't know if Debbie mentioned in her prior remarks is that Tanner Hospice serves almost 300 patients a year. Some of those patients have the ability and they have coverage to pay. Some of those patients don't. And it's really critical for us to make sure that we can provide not only access to care, but the best care possible for all of our patients across the community.
If you could you touch on those dates one more time? We want listeners to be able
Yes.
to know, write those down so they can go support this cause.
So join us for Nothing But Cakes on Tuesday, October 31st at Tanner Medical Center, Villa Rica. Join us on Monday, November the 6th at American Pie Pizzeria from 5 until 9. And then Chick-fil-A, Bankhead Highway on Thursday, November 9th from 5 to 9, as well as on November 9th, you can join us at Higgins General in Bremen for Nothing But Cakes. And then on Friday, November 10th and Saturday, November the 11th, Tropical Joe's in Bremen will be participating in Dine Out, Do Good.
Get you a little cake, get you a little pizza, get you a smoothie to wash it all down and do some good work. Debbie Brock, before we wrap up, we only have about 3.5 minutes left. I did want to ask, how folks could reach out to the program, but I do believe we spoke a bit before the program started. This program has recently been celebrated. This Hospice Care program, it appears, from what I understand, top 5 in the nation, top 5%.
That is true. We, through Strategic Health Partners, they rate hospice agencies across the nation based on patient satisfaction, family satisfaction. Those are the surveys that go out. And for the 4th year in a row, Tanner Hospice has been named as a top performer in the top 5% of the nation for patient satisfaction. Very proud of that. All the team. That's not me. That's that team that's out there providing that care every day. I know that one of the most common things we hear when people respond is they wish they had gotten their loved one in the program earlier. So that is key. Sometimes it's a little fearful, that hospice, people think that tends to mean giving up, but it's not. It's high quality, living the best life you can until the end of life.
And honestly, with the services available, the widespread resources available, the constant care 7 days a week that is available, I mean, those last few years, if they do end up, in fact, are the last few years, I mean, there's no more important time to be able to have peace of mind and clarity to celebrate good times with your loved ones instead of worrying about medicine and medical bill, worrying about all this stuff. This program can take a lot of that burden off and make those last few years extra special, extra meaningful.
Absolutely.
So, we're out of time, but if you could, website where folks could learn more about the program.
Well, at tanner.org. You
Excellent.
can see all about hospice services. Call our office. If you just want some information, somebody will come out to the home and talk to you.
Perfect. Debbie Brock, Nichole Fannin, thank you both for coming on the program today and chatting about these great things. And everybody keep an eye out for the Dine Out Do Good event coming up, starting with Nothing But Cakes on Tuesday, October 31st. Ladies, thank you for coming on. Everyone tuning in at home, we'll see you next time.